Good morning all, I am Dr. Sindhil Kumar, practicing diabetes in Shanti Clinic, Sairapat. November 14th is being celebrated as World Diabetes Day. One of the insulin discoverers, Banting, who discovered in the year 1921. So his birthday falls on November 14th. So as respect to him, we are celebrating on November 14th World Diabetes Day. World Diabetes Day is being celebrated mainly as a campaign to make people aware about the diabetes. On 2021 to 2023 World Diabetes Day campaign is access to diabetes care, if not now, when? Yeah, access to diabetes is very less because diabetic population is keeping on increasing. In fact, globally 500 million people, just imagine, half the billion are diagnosed with diabetes. And one more alarming data is almost 50% of the people don't know that they are diabetic. And another thing, 1 in 9 people are diabetic. So if you see 9 people, out of that 9, 1 is diabetic. That's what the data says. So to bring all this under control, we are following this campaign. And current year, November 14, 2022, the theme is Education to Protect Tomorrow. And obviously education is one of the very important assessment which all healthcare providers should be following. So the duty to control diabetes is not only with the healthcare providers, it also belongs to the public. The healthcare providers' duty does not finish just with giving the diabetic medications. It also follows with the proper following up of the patient, proper monitoring, assessing his diabetes status, checking whether he is able to follow the lifestyle modifications. Very important. I will tell drug later only. First comes lifestyle modifications. That's what the main assessment, the main education should be on lifestyle modifications. I always tell to public as well as my patients 3D approach. Always follow diet, proper diet, drill, proper exercise, discipline. Diet, reduce your carbohydrate intake, increase the protein intake. Don't take too much carbohydrates. Don't take much rice, don't take much wheat, increase protein intake. Don't eat too much at a single time. So all these are more prone for diabetes. And obesity is one of the main causes. So try to reduce your weight, which you have to follow the patients. Number 2, drill, exercise. WHO recommends at least 150 minutes per week. So see that you daily at least do brisk walking, 30 minutes minimum to half an hour, 1 hour. That depends upon your convenience. But minimum 150 minutes per week, exercise is must. Then coming to discipline, please don't overstress yourself because stress itself is one of the cause for diabetes. Adequate sleep is important. See that you have continuous sleep for 6 to 8 hours. Don't have in between sleep. Avoid daytime sleep. Very important. Another important discipline is avoid midnight snacking, which commonly people does, which is very bad for your health. Especially it will cause very poor glucose control. Late night eating causes your resting insulin to wake up, which is not good for insulin. And very important message which I want to convey during this World Diabetes Day is, yes, diabetes can be remitted. If you are going to follow this 3D approach and follow the proper lifestyle modifications and keep your body weight in check and maintain it normally, you can definitely remit your diabetes. An ideal patient who can remit diabetes is a young, newly diagnosed diabetic, obese patient. He can definitely remit diabetes because his weight will come back to normal. His insulin resistance can be reverted. Don't need to give medications. Who cannot remit diabetes is long-standing diabetes, more than 10 years, more than 15 years, elderly people, type 1 diabetes. In type 1 diabetes, insulin secretion itself will not be there. So those will have to be on insulin, or the type 2 diabetes, elderly, long-standing diabetes, genetic, family history, they should be on mild medications if they are following proper lifestyle. So no need to worry by seeing the burden data, but the best thing is diabetes can be remitted. You can keep in control if you are going to follow this 3D, what I told, diet, drill, discipline. So take a pledge everyone today on World Diabetes Day. Educate others also, educate the public, educate whomever you see. Tell them that screen for diabetes at least 6 months once or every 1 year and follow these 3D tips. And keep your sugar in control, keep your weight in control. Have a happy lifestyle, have a healthy eating lifestyle, be a diabetic free. Thank you. We will see you in next video. And I play my part in today's World Diabetes Day by sharing this YouTube video and educating others. Thank you.